Hi, my name is Lily. Welcome back. I'm a respiratory therapist here at Sleeplay.com. Today, we're going to touch on a subject that I get questioned a lot about, which is, do I have to wear CPAP all the time? Is this a forever thing? Can I stop using CPAP? I get that question all the time. Can I stop using CPAP? Well, technically you can stop doing anything. Is it going to be good for you? Not necessarily. And it depends also. I mean, if you had a mild sleep apnea, let's say, and you were like, I can't handle this, I can't do the CPAP, or I can't get used to it, or technically, I guess, it wouldn't affect you too much. It depends. It depends. As a respiratory therapist and with a lot of experience in this field, it does affect you because technically, you're going to have that obstruction. Like if you have sleep apnea because of obstruction, which is 90% or 75%, I would say, of the people that have sleep apnea because of obstruction, which means that you can have a deviated septum, or your tongue too thick, or your uvula too long, or simply that the muscles on your throat relax too much when you fall asleep and close, or any other type of obstruction, whether it's from an accident or something. As long as you have that obstruction, you're going to have sleep apnea because it's going to prevent you from breathing normally when you're asleep, okay? And some people ask me, what if I had surgery? What if I had surgery and took care of my deviated septum, let's say. And this, by the way, this happens a lot. That's not a guarantee that you're going to not have sleep apnea anymore. And they'll even tell you, even the ENT that does the surgery, that tells you about the surgery, they'll tell you that it's not 100% that it will take care of your apneas. What it could do, it could improve. So let's say that you have severe sleep apnea and you have surgery. I don't know, I've had patients that shave their tongue, they cut their uvula, the little thing on the back of your throat, fix their deviated septum, and yet they'll be fine for a year and then they come back and they have to use the CPAP machine. So there's no guarantee. So as long as you have that obstruction, then you're going to have sleep apnea. So yes. So I guess the most important question that you should ask is, why should I have to use it? Okay. And the answer for that is because it's very, very beneficial. CPAP, continuous positive airway pressure. What it does is it opens the airways, okay? It gives you continuous positive air, right? And then it opens the airway, because with a positive pressure, so that it doesn't close and so you don't stop breathing in the middle of the night or when you're asleep, okay? So that's what CPAP does. So if you don't have something doing that for you, then you're gonna have obstruction. Something is gonna close, whether it's your throat or whatever, and you're gonna have apnea. So yes, you should use it. Now, whether you use it now or you use it later, some people need time, or some people, what I see sometimes is that they wait too long. They wait until they had a stroke, they had a heart attack or something, and now the doctor is telling you, or your cardiologist is telling you, you have to use CPAP because you're having arrhythmias. When you stop breathing too many times, that puts a lot of stress on your heart. Okay, so like your heart is like running a marathon, It's running a marathon, and what that can produce, or what that does to your body, is that you can have arrhythmias, which means irregular heartbeats, and that can lead to cardiac issues, okay? You can also have memory problems with sleep apnea, okay, because you're not resting, and when you get to that deep sleep, that's where your brain stimulates learning, focusing, and memory, okay? There's also a correlation with sleep apnea and diabetes type 2. So there's a lot of things to unpack when it comes to sleep apnea. So yes, you can stop using your CPAP if you don't want to use it. I mean, you can be forced to use anything that you don't want to, but if you're having a hard time using your CPAP machine, I would ask you, try to find out what it is that's bothering you. Why are you having a problem? Is it your mask? If there is a mask that you're wearing that is very uncomfortable, there's a whole bunch of masks that you can choose from, okay? If you're claustrophobic and you don't want a full face mask, right? Well, then you can wear a nasal and just use a chin strap to keep your mouth closed. There's a lot of solutions to help you stay with your CPAP machine. There's also central sleep apnea, which differentiates from obstructive, because with central sleep apnea, it can be caused by illnesses that you have, like congestive heart failure, hyperthyroidism, also can give it to you, neurological issues, diabetes, what else? Yeah. With central sleep apnea, the way it works is the brain signaling, okay, to certain nerves, okay, so you're able to breathe. In other words, you can have the brain not sending signal to your hypoglossal nerve, which is the nerve that moves your tongue, okay, and there's an obstruction, and there's also the phrenic nerve, right? So you can stop breathing because the brain is not sending the signal to your phrenic nerve to move the diaphragm when you're asleep, okay? So that's more of a central sleep apnea than a obstructive sleep apnea. So you could have that. And a lot of times you have patients with central sleep apnea that don't even snore, and they think they don't have it, but they do have sleep apnea. So yes, I mean, there's so many things when it comes to sleep apnea, okay, that when you think about not using your CPAP, I would suggest you speak to your doctor first and see where you're at, because you were diagnosed with this condition and your doctor prescribed it for a reason, and it's to help you, okay? So don't look at it as a hindrance, look at it as something beneficial for your health. You're gonna feel so good when you use your CPAP machine. You just got to get over that huddle of getting used to that. But it's like anything, if you were to have therapy, if you pulled a muscle or your back or something, you had to have therapy, it's gonna be painful, to get that muscle back to where it needs to be. Everything that is a therapy, sometimes it hurts until you start feeling better. But I promise you, if you stick with it, if you try to find which mask is good for you, you will get used to it. I have more success stories than I do failures with CPAP machine, okay? Anyways, if you found this video helpful, like, share, and subscribe, okay? If you have any questions also, you can let us know. You can call us. This is sleeplay.com, and we'll help you as best as we can. All right? Thank you for stopping by. Bye-bye.